Good afternoon. My name is Afia Whitney, and today I will be presenting my argumentative essay on the sustainability of Guyana's healthcare expansion during healthcare worker migration. So this presentation examines whether the significant investments made in healthcare infrastructure can remain effective when many trained healthcare professionals continue to leave the country. I will discuss the main arguments supporting my position, consider a counter-argument, and explain why retaining healthcare workers is essential for a long-term healthcare sustainability. Okay, so invested billions of dollars in expanding and modernizing its healthcare system. So new hospitals, regional healthcare facilities, and upgraded medical services have been established across the country to improve access to healthcare. So, however, while infrastructure continues to expand, many doctors, nurses, and other healthcare professionals are migrating overseas in search of better salaries, working conditions, and career opportunities. The migration creates serious staffing shortages in hospitals and clinics. As a result, concerns have arisen or arise about whether Guyana's healthcare expansion can be sustained over the long term. So, my presentation argues that infrastructure development alone is not enough. Sustainable healthcare requires both modern and facilities and a stable workforce of trained healthcare professionals. All right. So the question and style of argument. The question guiding this presentation is, can healthcare expansion remain sustainable and amid, or should I say, during workers' migration? So the broad topic is healthcare infrastructure growth in Guyana, while the specific focus is healthcare worker migration. So basically, this is an argument essay written using the classical argument structure. So this means I present a clear position, support it with evidence and reasoning, acknowledge an opposing viewpoint, and then explain why my argument remains stronger. My position is that healthcare expansion cannot be fully sustainable if the migration of skilled healthcare workers continues. So, rationale for question and position. Um, So I selected this topic because healthcare affects every citizen in Guyana. The government has made major investments in hospitals and healthcare facilities nationwide. While these investments are important, many trained healthcare workers continue to leave the country. So this creates a significant concern because buildings and equipment alone cannot provide healthcare services. Patients depends on doctors, nurse, technicians, and other healthcare professionals. Um, so therefore, the issue of worker migration directly affects the success and sustainability of healthcare expansion and is relevant to the well-being of all Guyanese citizens. Thesis statement. So my thesis statement is although Guyana has invested heavily in expanding healthcare infrastructure, the healthcare system remains unsustainable because of the continuous migration of skilled healthcare workers. So the resulting decline in patient care and excuse me, and the breakdown of effective management and teamwork within medical institutions. So this thesis highlights three major reasons supporting my argument. So first, migration causes persistent staffing shortages. Second, these shortages negatively affect patient care. And thirdly, healthcare institutions struggle to function effectively. When experienced staff members leave, these three reasons form the basis of my main claims. My main claims. So my first claim is that healthcare worker migration undermines sustainability of by creating staff shortages. So when trained professionals leave hospitals, often struggle to fill vacant positions. According to Georgetown Public Hospital reports, hundreds of nurses resigned within a short period, contributing to workforce shortages. So my second claim is that staff shortages reduce the quality and efficiency of patient care. Fewer healthcare workers mean longer waiting times, increased workloads, and greater pressure on the remaining staff. And so my third claim is that shortages weaken hospital management and teamwork. So effective healthcare requires collaboration among healthcare professionals. When experienced workers leave, leadership, communication, and things like coordination within healthcare institutions became more difficult. So together, these challenges make it difficult to sustain healthcare expansion over time. My counter arguments slash middle ground. So it is important to acknowledge the opposing perspective. Some people argue that new hospitals and modern facilities improve healthcare delivery and may attract healthcare professionals back to Guyana. Um, Others believe that training programs can increase the number of healthcare workers entering the profession. So these are valid points because infrastructure development and workforce training are important investments. However, the root causes of migration, such as better salaries and opportunities abroad, remain unresolved. As a result, newly trained workers can may also choose to leave the country. So therefore, while new facilities are beneficial, infrastructure alone cannot guarantee a sustainable healthcare system. So, if healthcare workers continue to migrate, most definitely it won't be benefited at all. And that would have brought us to my conclusion. So, in conclusion, Guyana's healthcare expansion cannot remain fully sustainable without addressing healthcare worker migration, although significant investments have been made in hospitals and medical facilities and so on. Migration continues to like weaken the healthcare delivery by creating staff shortages, reducing the quality of patient care, and affecting management and teamwork. Healthcare workers are the foundation of any healthcare system. So buildings and equipment are valuable, but they cannot replace skilled professionals. So to ensure long-term sustainability, Guyana should focus on improving salaries, working conditions, retention strategies, and professional development opportunities for healthcare workers. Thank you so much for listening. Um, these are my references.